All right, guys. Welcome to Chapter 6, The Human Body. This chapter is particularly dense, so we've broken this video series into multiple sections for you guys to make it a little bit more bearable. And also, the way the videos are broken up, they kind of resemble the various different body systems that we will be working with. So you can always go back and look at a particular section that you may not be having a good time getting to know. So anatomy and physiology is a very complex branch of medicine. There are a lot of different parts to our body, and it's very difficult to sit through one chapter and expect to know everything. But hopefully this will help you guys get a basic understanding of the main structures of the body that we're concerned with and how the parts work together. Real quick, some vocabulary. Anatomy is the physical structure of the body, where physiology is how the physical structure functions and also how it functions with various other body systems that we're going to kind of discuss as we go through. But first, we are going to break down some common vocabulary that you should get to know, and how we can break up the body into various different planes. Topographic anatomy applies to the body in anatomic position. When we refer to anatomic position, the patient is facing you, palms forward. And we will always refer to the patient's left and right, just to prevent any confusion. Because if we use our left and right, it might mix up hospitals when we bring patients to them. So remember, we divide patients up by the left and right. Now, we can also divide the patient's body into several different planes, as you can see with all of these different colored dividers in this image. So looking at this first one, the frontal plane, or it's also known as the coronal plane. This divides the body in half, front to back. So if we were to cut this person down the side of her body in the middle, we would create front and back halves. So frontal plane. Sagittal or lateral planes divide the patient in half, left to right. So if we were to cut straight down the middle through her nose all the way down, we would have left and right. So you can say left lateral side or right lateral side. Then we have the transverse or the axial plane. This cuts the patient in half from top to bottom. So if you ever remember those old magic tricks where they saw somebody in half and they separate the person's body in half and they kind of cart them around the stage. This would be a transverse cut of that individual. So kind of using this person's belly button as a landmark. We're kind of cutting through that. So you have the top and the bottom. So here are some of the most common directional terms that you are going to come across and you are likely going to use. So we have inferior, which always refers to below. So in this example, the neck is inferior to the head. Now sit there, look in the mirror, and really see that your neck is below your head. It's not above it or superior, where The thoracic cavity, or your chest cavity, is superior to your abdominal pelvic cavity, which is your stomach area or your abdominal region. The lateral, as we've already touched on real quick, this is towards the side. So you can say ears are lateral to the eyes. Or if you want to say you have one ear on the left and right lateral side, that's also acceptable. Anterior has an alternate term of ventral, and this refers to the front. So when we divide the body into front and back halves, we say the anterior portion, or the more front part, is the ventral side. So you can say the eyes are anterior to the brain, or ventral to the brain. Posterior also has the name of dorsal, which means towards the back. So your pharynx is posterior to your mouth. An easy way to remember dorsal are dorsal fins of sharks, whales, dolphins, so on and so forth. Those are on their back. So that's the posterior side. So then we have bilateral, which are paired structures. So we have two lungs, so the lungs are bilateral. There's one on each side. We have two arms, so we have bilateral arms. Distal refers to a point that is further from a point of attachment to the trunk. So for example, your fingers are distal to your wrist. So your fingers are further away from the trunk of your body, which would be your chest area, than your wrist. Your wrist is closer. Proximal refers to an area that is closer to the point of attachment to the trunk. So your elbow is proximal to your wrist. Or in the previous example, we can change it up. We can say the wrist is proximal to the fingers. All right. Deep simply refers to more internal. So your dermis is the deep layer of the skin, and we will touch on that when we get to the skin. Superficial refers to more external. The epidermis is the superficial layer of the skin, or the most external. This is what we would actually be looking at when we're looking at the skin on the surface. Now, there are many more vocabulary words that you will need to know going forward. But these ones are the most common terms that you're going to come across on a regular basis.